Hello everyone, this is Brenda, owner of Zackel & Associates Legal Nurse Consultants. In the last Surgical Sunday video, I discussed physiological effects of lateral positioning, best practices, and special considerations. Today's video is about lithotomy positioning. In lithotomy, a patient's legs are lifted in stirrups from the supine position. Common surgeries that may require patients to be placed in lithotomy position are a prostatectomy, hysterectomy, oophorectomy, anterior-posterior repair, or any other abdominal, gynecological, laparoscopic, rectal, urological, or genitourinary surgery. The lithotomy position places extra pressure on the occiput, scapula, olecranon processes, sacrum, coccyx, and depending on the type of stirrup, the popliteal fossa. When the legs are elevated, increased blood return leads to a decrease in cardiac output to compensate. Hypoventilation can be caused by a restriction of the diaphragm secondary to the shift in abdominal contents. This is more common in obese patients. Changes in blood flow to the legs can also increase the risk of DVT. Best practices include: keep the head and neck in a neutral position. Align the patient's buttocks so they are even with the lower break of the OR bed. Avoid direct pressure on the perineal neck, locate at the head of the fibula and medial side of the knee, and pad potential pressure points. It is important to support the largest surface area of the leg while taking precautions for the different types of leg holders used, such as a boot type leg holder, commonly known as yellow fins, knee crutch leg holder, and candy canes. Correct placement of a safety strap can be difficult, and best practices are not defined in literature. Also, at the end of the procedure, at minimum 2 providers should work together to release the legs, slowly bring them together, and then place them on the OR bed. AORN recommends maintaining patients in lithotomy position for the shortest amount of time possible and repositioning them at established intervals. It is important that the surgical and nursing team carefully assess positioning risk on a patient-by-patient basis and formulate a plan to minimize those potential risks. Did your client suffer an injury from faulty patient positioning? Trust our team at Zackel & Associates and let us help you identify how the standard of patient care was neglected. This is Brenda Zackel, bridging the connection between medicine and law.